Hey everyone, welcome to the Chapter 1 lecture for medical terminology. This chapter is all about learning the structure of medical language and medical words. So this class really is a language course, just like French or Mandarin. You are learning a language not that's spoken in a specific country, but a language that's spoken in a specific profession, and those are the healthcare professions, and there's lots of them. So healthcare is not the only profession with its own language. You've got legal jargon and maybe like Hollywood or Broadway jargon. So medical language is really helpful if you're going to be working in a healthcare facility, which many of you likely are if you're taking this class. It's also really helpful as a patient. When you go for your doctor's appointments, you'll just be able to understand a lot more of what's going on. And then also, if you, like me, enjoy watching TV medical dramas, it also helps you follow along in those shows as well. So medical language, like any language, has several key features. So it's important to be able to hear and understand a language. You need to be able to speak it correctly. So sometimes people might be able to speak a language like French, but they have terrible pronunciation. They can understand it great, but they don't speak it very well. So pronunciation is also really important to be able to speak a language. Also being able to read it. Some languages have entirely different alphabets. Not so much medical language, but there are some maybe weird patterns of letters, learning how to spell things correctly so that you can communicate correctly. So those are things we're going to be focusing on this semester when learning medical language, not just learning the definitions of terms, but also how to say them correctly and how to spell them correctly so that we can make sure that we can communicate effectively. This is an old slide, just ignore it. This is how I did quizzes when they were in class. So the outline of this chapter lecture, we're going to talk about etymology, which is a fancy word for word origins, where words come from. We're going to talk about how to correctly singularize and pluralize words in medical terminology. They oftentimes come from other languages, so we don't necessarily use English pluralization terms. And then we're going to spend a significant amount of time talking about medical word parts, so prefixes, suffixes, and combining forms. And then we'll do a little practice of analyzing and building medical words from their word parts. So etymology is a word that literally means the study of word origins, where they come from. So most medical terms come from Latin and Greek. The ancient Romans and the ancient Greeks really did a lot of anatomy and scientific discoveries, and so they named things, and we've kept true to those names. And even when we discover new diseases or new bodily features, it's oftentimes customary to give them Greek or Latin names. For example, in taxonomy in science, like all organisms have a Latin scientific name. So even ones that have been discovered recently, we stick with that language. So those are two really popular languages in science. Some examples of some body parts that come directly or very closely from Latin or Greek are listed in this table here. Another common source of medical words are Old English, Dutch, and French. Some examples here that you might recognize. Bladder is actually from the Old English bladder. Physician actually comes from the French language. So physicien, I can't speak French, but it's basically the same word in French. An eponym is a term that is named after a proper noun, so a person or a place. So usually this is a person who discovered that body part or disease. Sometimes it's named after, like diseases are named after famous patients or first patients. Sometimes they're named, especially infectious diseases, a lot of times are named after a location where there was initially a big outbreak. So because they're named after people or places, they are proper nouns, and proper nouns are always capitalized. So it's sort of another way to recognize when something is actually named after someone. So Purkinje fibers, Usually that is capitalized. Purkinje was an anatomist who first discovered these nerve fibers in the heart. Down syndrome is actually named after John Langdon Down, who was a physician who first described the condition. Katayama fever is named after a location where there was a big outbreak in Japan. The Krebs cycle, that's a cell cycle in metabolism, that's named after the biochemist who discovered that cycle and named it after themselves. All right, so when we have terms in anatomy and physiology, we oftentimes have, you could talk about one finger or many fingers. You have one leg or two legs. So we often have reason to pluralize nouns. And since a lot of body parts, maybe not external limbs, but internal organs for sure, have these names that come from Greek and Latin, we do have to follow these special pluralization rules. So if the singular ends in A, like for example, vertebra, just the simple letter A, it's pluralized to vertebrae, so we add an E to the end. So it's not vertebras, it's vertebrae, or vertebrae. You can pronounce it either way. Us, an ending of us, changes to I at the end, so a classic example is bronchus becomes bronchi. Not a terribly common one that we see, but it becomes a when you pluralize it. So a classic one, not in this class, but other classes, bacterium is singular, bacteria is plural. We are usually talking about bacteria because they're so small. We're usually talking about a bunch of them. But if you were going to singularize that term, the correct singular form is bacterium. IS, where's the end in IS? If they're from the Latin root, then you pluralize them by changing it to ES. So testis is singular, testes is plural. We can do the same for things like hypothesis becomes hypotheses, or diagnosis becomes diagnoses. EX and IX, another one that's very uncommon to see, but I think some of the only examples are right here. It becomes ICES when you pluralize it. So apex, the plural of apex is apices. The plural of helix is helices. And that one is used often. Though sometimes you'll see apex, people will just say apexes. So although there are these rules, you will sometimes see in healthcare settings where they are violated, because not everyone knows the proper pluralization rules. But my mnemonic for this one comes from Harry Potter. I'm a huge Harry Potter fan. And there's a potion, the lucky potion, is called Felix Felicis. And it is basically, that is the Latin word for luck. So it's basically luck, lux. For words that come from the Greek, if they end in IS, then you change the suffix from IS to IDES. So iris becomes irides. I will tell you this is a pluralization rule that's violated all the time in the real world. You go to a doctor's office and they will probably refer to your irises, even though technically the correct pluralization is irides. NX, not a very common. I think there's only 3 words I can think of that end in NX. And that's phalanx, larynx, and pharynx. All right. So phalanx is a finger, a digit. So you have multiple digits. So we would pluralize that as phalanges. So one phalanx, multiple phalanges. Your larynx, you have one voice box, and your pharynx, your throat, you have one pharynx. So there's really not a lot of opportunities to need to talk about those things in plural. So, but if you had multiple larynxes, you would say larynges. So those are the 3 words that would follow that rule. Oma is a very common suffix. It has its own meaning. It means tumor or mass. The proper pluralization of that is omata. And you see this a lot in scientific books. So like a word that's not a medical word is Stroma for plants, they have these little holes called stroma, and stromata is the pluralization. A fibroma is like a fibrous growth, and if you have multiple of them, then you have fibromata. A carcinoma is a cancerous tumor. Plural would be carcinomata. Again, this is another place, though, where you will see in the real world people using English pluralization, so carcinomas or melanomas, but really it should be melanomata. And I'll skip the last one because it's not very common. Alrighty, so medical words and word parts. This is where most of the meat of this chapter is in, and really this is the foundation for the rest of the course. So understanding this concept is the foundation of understanding medical language and being able to define medical words. But it can also extend to language in general, because most words, even in the English lexicon and other languages, do come from these roots, maybe with a prefix or a suffix. So understanding how to do this is very applicable, widely applicable. So the three parts of a medical word are the combining form, which is this middle piece of the word. It contains the word root. And usually the word root is, well, it can be a lot of different things, but it's really the foundation of the medical word. All medical words have a combining form. They also all have a suffix, an ending, something to close it off. They can have multiple combining forms, actually, but they can only have one suffix. And then in parentheses here, I've listed the prefix. Prefix is an optional part of the medical word. Some medical words have one and some don't. The prefix and the suffix both kind of help to add descriptors to that combining form. So basically all of the vocabulary in this class that you're going to be learning is broken down into these parts. You're going to be learning different meanings of different prefixes, suffixes, and combining forms. And with that knowledge, the cool thing about that is, if you learn 1,000 different word parts, you can mix and match them together like puzzle pieces and actually have a vocabulary of like 30,000 words. I don't know the math on that. I didn't actually do it, so don't quote me on that. But I guess what I'm trying to say is by learning word parts, you actually maximize your vocabulary even more. So let's start with the combining form. So it's the foundation of the medical word. It really gives the medical meaning of the word, and you can have multiple combining forms in a single word. So an example here is abdominopelvic. Abdomino and pelv are both combining forms, ic being the suffix there. So most of the vocabulary of the course is going to be the combining forms. And there are several that I like to call the duh combining forms, the ones that basically the combining form is the meaning. So abdomino means abdomen, appendo means appendix, intestino means intestine. So those are going to be ones that are really easy to learn because you don't really have to learn anything. They are what they say they are. So those are helpful. You learn those very quickly. Then there will be ones that I say are familiar. They are ones where the combining form doesn't actually sound the same as the medical meaning, but are common enough that you probably already know them. For example, cardio means heart. A lot of people know, like cardiac arrest or a cardiologist has to do with the heart. So that's one that's probably already familiar. Derm, dermatologist for your skin, or like dermabrasion is for exfoliating the skin. So these are ones that, although they don't derm doesn't sound anything like skin, you may already know it from being familiar with parts of the body in medical field. Then there will be ones that are less familiar, and these are the ones you'll probably have to practice more in order to cement into your memory. Things like cholecysto, which is the combining form for gallbladder, or costo, which is a combining form for rib. So these don't sound like their meanings, and they also are not maybe very common in the vernacular. So those are ones you'll end up needing to practice more. Another thing that can complicate the whole thing with combining forms is that a lot of times there's a lot of synonyms. There's multiple combining forms with the same meaning. Sometimes they are of the "da" variety, like "calo" and "colano" both mean colon, so they're just sort of like a shortened version of the same combining form. But then you have things like dermo and cutaneo, which don't sound anything alike, and they don't sound anything like skin, but that's what they mean. So that can sometimes trip people up. What some of my students will do is they'll put the synonyms on the same flashcard so that it can help remind them that they have the same meaning. I love asking synonym questions on tests because I feel like I can test you on multiple combining forms at once. So definitely know your synonymous combining forms. So those are some important combining forms. Another important part of the medical word is the suffix. This comes at the end of the word, and it just modifies it a little bit. They're usually very short. They're usually like 2 or 3 letters, but they can be longer, and they pretty much all have a suffix. Just one, though. So you can have suffixes. There's a whole bunch of short suffixes that all mean pertaining to. So ac, al, ar, ary, ick, ein, in, iv, and us all have the same meaning. They're basically just a clean little ending to a word. So cardiac means pertaining to the heart. Muscular, that AR just means pertaining to the muscles. Probably because musculac just didn't sound as good. So they came up with multiple different suffixes to mean pertaining to, just by what kind of feels good coming off the tongue. There are suffixes that indicate a process. Ation, A-T-I-O-N, is a process of doing something. So urination is the process of making urine. Digestion is the process of breaking down food. All right, so I-O-N and A-T-I-O-N have kind of the same meaning, a process or an action of. Lysis, pronounced alysis at the end of a word, is a process of breaking down something or breaking open. So hemolysis is the breaking of red blood cells. Trying to think of another lysis term, but can't think of one at the moment. Suffixes for diseases and conditions. Ia is a very common one. A lot of students will make the mistake of thinking it's just another one of those combining forms that means pertaining to, but it's not. It means a condition. So like a lot of diseases, their names will end in IA, like pneumonia, septicemia, leukemia. Okay, a lot of diseases end in IA, it just means condition. Ism is another ending or suffix that means a disease of. Usually these are specific diseases, like of specific organs, like hypothyroidism or hyperthyroidism. Itis is one we will see over and over and over again because it means inflammation of or infection of. And so as we work through different body systems, basically any and every part of the body can be infected. And so you just add itis to the end and you have infection of that body part. So you can have tonsillitis of the tonsils. You can have conjunctivitis of your eyes. You can have dermatitis of the skin, hepatitis of the liver, and on and on and on. Megaly, like mega, means big or large. So mega can actually be a prefix. Megaly is the suffix version, and it just means enlarged or enlargement of. Oma is one I often have students star. Oma means tumor or mass. A lot of cancers involve a tumor or mass because they're an overgrowth of cells, but not all tumors are cancerous. So a lot of times students think that oma means cancer because a lot of cancers end in oma, lymphoma, melanoma, carcinoma, glioma. I mean, you can keep going because they're all tumors, but not all tumors are cancerous. I think that's a really important thing to know, especially when conversing with lay people, because a lot of lay people hear oma or tumor and they automatically think cancer. But a classic example of an oma that is benign is a lipoma. Lipomas are like tumors of fat, a growth of fat, and they're like almost always completely benign and harmless. But they scare people. They're like, a lipoma, oh my gosh, I have cancer? No. So just make sure that you drill that into your head. Oma does not necessarily mean cancer. It just means tumor or mass. Osis means a condition of. It's kind of synonymous to ia, that first one. Pathy, though at the end of the word it's going to be pronounced apathy. Apathy means a disease of. And we use it as sort of an umbrella term. So like if we're talking about heart disease, we would call that cardiopathy. Now there's like hundreds of different heart diseases that fall under that umbrella of cardiopathy. If you have disease of the nerves, you would have a neuropathy. A lot of times it's an initial diagnosis, like if you go to the doctor with pain and they do some tests and they determine it's definitely nerve pain, so you have some kind of neuropathy. Now we need to do more tests to figure out which neuropathy it is. Some terms have to do with medical or surgical procedures. Ectomy is a very common one. That's the removal of surgical excision, to cut and remove from somebody's body. So an appendectomy is a very common type of removal surgery. But you could have a hysterectomy to remove your uterus, or a tonsillectomy to remove the tonsils, so on and so forth. Gram and graphy are related suffixes. So graphy means a process of recording. So that's the procedure. Like you might go in for an x-ray and you have radiography. That's the procedure of radiography, taking a recording using radioactivity. The x-ray itself, the printout, would be the radiogram. All right, so the example here is a mammography is the procedure, and the mammogram is the actual picture that's printed out. We can do the same thing with scope and scopy on this slide here. All right, so scopy is the procedure, or it's usually pronounced oscopy at the end of a word. So you might have an endoscopy or a colonoscopy procedure, and the colonoscope or the endoscope is the actual tool. It's the actual camera that goes into view. So an oscopy is a procedure to view using a camera, and the scope is the actual camera that's used. Metry, my little mnemonic pictures here of a ruler or a meter stick. Metry means to measure. So think of a meter stick is used to measure things, so metry. I'll point out these little pictures too to just say that pictures can be a great mnemonic for you. You can even put them on your flashcards to help you remember what a word means. Ostomy is another one that's very common. An ostomy, it just says stomy here, but at the end of the word it'll be connected with an O, so it'll be pronounced ostomy. It's basically a surgically created hole or opening that's usually connected to a bag that can be created oftentimes in the gastrointestinal system. If somebody has cancer or a disease that ruins part of their gastrointestinal system and they have to have it removed. So there's a colostomy, is one in the colon. So basically you poop into a bag out of your stomach rather than, or out of your abdomen, rather than out of the rectum and the anus. Therapy means treatment. As a word, standalone word, therapy means treatment. And as a suffix, it also means treatment. So you might get psychotherapy, or you might get chemotherapy. And then tomy, that suffix, which is going to be pronounced otomy at the end of a word. There'll always be this combining vowel that glues the combining form and the suffix together, is usually an O. So laparotomy, otomy just means an incision, to make a cut or an incision. So a laparotomy is a cut or incision into the abdomen, because laparo means abdomen. You might have an craniotomy, which is a incision into the skull if you're going to have like brain surgery. Some different suffixes that mean medical specialties. Ist, going with the second one first. Ist is someone who specializes in. So you might have a therapist, or a cardiologist, or a pulmonologist, or a psychiatrist. All right, all of those are professionals, people that those are jobs. Iatry is a suffix that means medical treatment. Iatro is a combining form that means medical treatment. So some of these meanings can be made into different word parts. You can have iatro as a combining form, or you can have iatry as a suffix. So there's that. And then there's logy, or ology is how it will be pronounced at the end of a word, and it means the study of. So every chapter we're basically going to be titled with an ology, the study of cardiology, hematology, gynecology. These are all fields of study within anatomy. So as you can see from the amount of slides and time we took on them in lecture, combining form suffixes are probably the more abundant of the words. And we really learn most of the prefixes and suffixes that you need to know in the first chapter. So we learn a handful of new ones as we go through the chapters of the book. But the last word part is the prefix, and the prefix comes at the beginning of the medical word. It is optional, so not all medical words have it. So usually I have those parentheses around the prefix puzzle piece. And it also helps to add descriptors to that combining form. So some examples. We've got ones that indicate location or direction. Endo means within, and so does intra. So endo and intra are synonymous. They're synonyms. Epi means above, upon, or above. So we'll talk about mnemonics more in our live sessions as well, but some that stick out to me from previous semesters I'll go ahead and mention. So I had a student one time she was having a hard time remembering that epi meant upon or above, and I said, well, what does epi make you think of? And she says, it makes me think of an EpiPen, like for allergies. And I'm like, okay, so think of an EpiPen like on top of a cabinet. So if you need it, it's above or upon the cabinet. And it worked. Every time she saw epi, she thought, oh, EpiPen on the cabinet. And she remembered it meant above or upon. So coming up with mnemonics in that weird way, what does it make you think of? And then how can we connect that with the meaning of the word? Inter and intra are very similar. They're very commonly confused by students, but they have different meanings. Inter means between, and intra means within. So you might star those. Make sure you practice them and you keep them straight, because we see them in a lot. They come up a lot, and they'll come up a lot on tests because I know they throw students. Some others indicating location. Peri means around. So for me, I just think perimeter. The perimeter of something, like the perimeter of a circle in math, is the distance around. It also uses that prefix. I had a student once come up with the mnemonic. I guess they liked Phineas and Ferb, the TV show / books. And there's a platypus called Perry the Platypus. So we said, well, just think of Perry the Platypus running in circles. Peri means around or to encircle. So for example, pericardial. The pericardial membrane is the membrane around the heart. It pertains to around the heart. Post and pre are opposites. Post means after or behind, and pre means before or in front of. And those are ones that are used in a lot of English words too, so a lot of times those are easy for students to master. Sub means below or underneath, like a submarine is named that because it goes under the water, submarine. Trans means across or opposite. We use it a lot in medical when we're talking about going through the skin or through, so you might have a transdermal injection that goes through the skin, or you might have to stick a needle like through the liver to get to another organ. So if it goes through, then it's going trans. Transvaginal ultrasound uses a probe that goes through the vagina to see inner organs. You can have prefixes that indicate an amount or a speed, as we'll see on the next slide. So mono, bi, tri, and quadri respectively mean 1, 2, 3, and 4. Poly means many. So if you have, what's the word? Polymyalgia? No. Fibromyalgia? No, I'm thinking fibro. Anyway, polydactyly is one of my favorite terms. That's people who have an extra finger or an extra toe. They have many of them. Hemi means half. Think of the earth has 2 hemispheres. Though in the case of the earth, the hemispheres are north and south hemispheres. In the case of the body, when we break it into hemispheres, it's usually right and left sides, the right and left hemisphere. So the brain has hemispheres. If you have a stroke, you may end up with paralysis on only half of the body, which is called hemiplegia. Hyper and hypo are opposites. Hyper means excessive or more than normal. I think of like, we use the term hyper to describe children's behavior a lot. If they're like really excited and overactive, we say they're hyper. So that's hyper. Hypo is the opposite. And I sometimes like say it with the voice of Eeyore in my head, like from Winnie the Pooh, and be like, hypo. Like it means things are slower or less than normal. So like you might have the hypothyroidism, which is a low performing thyroid, versus hyperthyroidism, which is an over-performing thyroid. Same thing with blood pressure. You may have high blood pressure, that's hypertension, or you may have low blood pressure, that would be hypotension. So they sound kind of similar, so you do have to kind of enunciate so that whoever you're talking to is clear which one you're talking about. Tachy and Brady are also opposites. Tachy means fast. Brady means slow. I had a student one time, I was like, well, how could you remember those terms? And they said, well, I remember Brady because of Tom Brady. And I'm like, I don't watch sports. I know Tom Brady's like a football player, I think. I don't know anything about him. And I was like, but isn't he, like, if he's like an athlete, wouldn't that mean he's fast? And they said, yeah, but he's kind of slow-witted or slow-minded. And so I guess that's funny if you know Tom Brady and have opinions about him. Just another fun story to help you remember some of these terms. So tachy is fast, Brady is slow. And these are prefixes that you'll see when you're referring to things like heart rate, breathing rate. Some prefixes will indicate other things, degree or quality. A and an are synonymous prefixes that mean without. So someone who's not making sperm, maybe they damaged their testes, or maybe they have had a vasectomy, so it was on purpose, that they're not making sperm. So we would say that condition is aspermia, a condition of no sperm. An is the same thing, except we use it with combining forms that start with a vowel, because saying aesthesia would be weird. So we say anesthesia. Anti means against, so something that works against things, like antibiotics work against bacteria, or antipsychotics or anticonvulsants. You see it a lot in drug categories. D means reversal of. So degeneration, things that are degenerative diseases, often start with D as a prefix. Dis, notice the spelling here. In English, we have dis as a prefix, but it's usually spelled D-I-S. But in Medicalese, it's spelled D-Y-S, and it means painful, difficult, or abnormal. And it's a really, really common one. Like itis was a really common suffix. We'll see dis a lot. So if you have any symptoms of pain in an organ or part of the body, you just sort of add dis to the beginning of that. So dysphagia, phago means eating or swallowing. So dysphagia is a condition of difficulty or painful eating or swallowing. Eu and mal are opposites. Whoops. Eu means normal or good. So it's important when you are assessing a patient to not only note things that are abnormal about them, but also things that are normal about them, just to sort of prove that you did look at those things. So if you take somebody's blood pressure and it's normal, you're going to report that. If you take their breathing rate and it's normal, you would report that. So normal breathing is eupnea. Mal means bad or abnormal. Malnutrition is insufficient, not bad nutrition. Malrotation of a bone or a joint, okay, means bad. Another Harry Potter reference here, Disney and J.K. Rowling both like to use Latin terms in naming characters. So in Harry Potter, one of the villainous characters is named Malfoy. The last name of the family is Malfoy. And that's not an accident. Mal means bad. They gave the villainous character that prefix on purpose. Same thing with Maleficent, also has that. She's a villain. Well, at least in the original stories, she is. Re means again and again. So it basically means repeat. Repeat has the prefix that means repeat. I guess it's kind of a redundant word. All right, so now that you know a bunch of different word parts, you know the 3 different types of word parts, the prefix, suffix, and combining form, and now you're familiar with some of the different ones specifically, we can learn how to analyze and define medical words. So these are sort of the instructions. We're going to just walk through it in the next couple of examples. So the first thing you want to do, you look at the word and you want to divide it into its combining form, its prefixes, suffixes, and combining forms. So this word here, hepatomegaly, does not have a prefix. Hepato is the combining form and megaly is the suffix. So we've separated it into those 2 parts. Now we can define each of those parts. Hepato means liver and megaly means enlargement. So now we just take those meanings and we put them together into a short phrase. And we say hepatomegaly means enlargement of the liver. So usually when you build a medical word, you're going to have prefix, combining form, suffix, it goes in that order. But when you define it, usually you state the suffix definition first, then the prefix if there is one, and then the combining form. You'll just see that's sort of how it makes sense. All right, so here's another one, pericarditis. Peri is a prefix, card or cardio is the combining form, and itis is the suffix. So cardio means heart, itis means inflammation, peri means around. We put it all together and we get inflammation around the heart. That's what pericarditis literally means. So I always start it with the suffix, inflammation around the heart. This is one of my favorite examples, psychologist versus psychiatrist, because before I started teaching medical terminology and really learning it, I knew that these were 2 different types of mental health professions, but I could never keep them straight. I could never remember which was which. And I knew one could prescribe medicine and the other couldn't, but I could never remember which was which. But once you know medical terminology, you never forget because it's obvious, it's in the word. So both of these have psycho as their combining form, which means mind. And they both have ist as a suffix, which means a professional. So they're both mental health professionals. But a psychologist, ology, logo, all right, means the study of. But iatry, iatro, as a combining form, means medical treatment. So the one that's involved in prescribing medications would be the psychiatrist, the one that's involved, who specializes in the medical treatment of the mind, versus the psychologist, who's going to sort of analyze, talk therapy kind of stuff and study the mind. So we build medical words sort of the same way, but backwards. We just select prefixes and suffixes and combining forms and put them together so that they have the meaning that we desire. A little bit of grammar to doing that properly. If the combining form, if the suffix begins with a consonant, so in this case L, logi, all right, then we need to use a combining vowel, which is almost always O, in order to sort of connect the two words together. So instead of saying cardiology, we say cardiology. So we keep that combining vowel when we combine it with logi. If we are combining it with a suffix that starts with a vowel, then we drop the combining vowel, because then we don't need so many vowels. So cardio plus ac becomes cardiac. We got rid of the O in that case. So we'll do some practice exercises where you guys build some medical words, and that's just how to do it properly. So one of the last things in the chapter is talking a little bit about pronunciation. So we said pronunciation is an important part of speaking a language, of being able to communicate in a language. So the textbook has these, and also the vocabulary lists I give you have these pronunciation guides. And so it breaks the word down into how you pronounce each syllable of the word. And then if the syllable is capitalized, that means it's accented, or I like to say you say it a little bit harder or a little bit louder than the others. So this word is pronounced appendectomy, and this one is arthritis and gastric, laryngitis. This one is oftentimes mispronounced, but it is mammography. A lot of people will say mammography, which is not right. It's mammography. Pneumonia and therapist. So maybe pause and try them yourself. Make sure that you can say them correctly. For all of the vocabulary pronunciation words that you have for this semester, I do give you this pronunciation guide here, but I also make pronunciation videos that you can watch on YouTube if you'd rather just learn them auditorially. So a lot of this medical language will be spoken verbally in a healthcare facility, but you also see it written most commonly in medical records. Anyone who works in healthcare deals with medical records. If you are a patient, you have a medical record, and things in the medical record are recorded using proper medical terminology. So some terms pertaining to the medical record, which by the way is a legally protected document. You have HIPAA privacy rights. So only people who are actually directly involved in your healthcare are allowed to access your health information. It keeps your health information private. It's a law. It's also probably the most common reason for healthcare professionals to be fired from their job is for HIPAA violations. So if you work in healthcare, make sure you take that very seriously. You could do surgery on the wrong leg of a person and still probably keep your job. But if you share that person's health information with someone you're not supposed to, you would most likely lose your job. All right, so some of the medical terms to know that pertain to the medical record, like when you go to the doctor and you're getting in because you don't feel well, and you walk in and they'll say, well, so what are you here for today? What's bothering you? And whatever you say, that is your chief complaint. And they usually write down your chief complaint verbatim, whatever the words out of your mouth are. Like, I feel like there's an alien trying to bust its way out of my stomach. They will write that down. That's your chief complaint. And then they'll ask you questions. Well, when did you start feeling that way? How long has this been happening? That's called the history of the present illness, and it's abbreviated HPI. Then they'll also start asking you questions about, well, what illnesses have you had before? Have you had any surgeries? That's your past medical history, or your PMH. Then they will perform a physical examination where they actually, take your vitals and listen to your chest with a stethoscope, or listen to your abdomen and maybe do some palpation. We'll talk about a lot of these terms in the next chapter, but that exam is called the physical exam, or the PE. And then hopefully the doctor will be able to give you a diagnosis, which in the medical record is often abbreviated as DX. So medical records used to be, when I was a kid, they were all physical documents in these folders with sorted alphabetically. But now most medical records are electronic. They're available on a computer, which makes storage and retrieving them much easier and much faster. So those are called electronic medical records, or sometimes EMR as an abbreviation. Speaking of abbreviations, there are a lot in the healthcare field, and you'll see them listed at the end of every chapter in the textbook. I generally do not go over too many abbreviations in the course, because the thing about abbreviations is you can have the same set of letters mean two different things in different contexts. For example, CPR can stand for computerized patient record. If you're someone who works in administration or health information technology, that's what CPR means to you. But if you're an EMT or an emergency care professional, it stands for cardiopulmonary resuscitation. So I tend to only teach if I have an abbreviation listed in the lecture notes and we go over it, it's one I want you to know because it's incredibly common and somewhat unique. But I don't go over all of the ones in the chapter because, again, they're things that once you get into the healthcare field, you will learn the ones that you need to know, like this, and there's no point in really memorizing them without context. So don't worry about all of the abbreviations at the end of the chapter, only the ones I go over in my lecture notes. So that is the end of the show. I'll see you for chapter 2.